over 200 health facilities run by the World Health Organization in Afghanistan have closed or suspended operations due to funding shortages. Cuts to aid, particularly through USAID, have severely impacted Afghanistan's health system, leading to the closure of numerous health facilities and a reduction in access to essential healthcare services, including maternal and child health, vaccinations, as well as treatment for malnutrition. Now, these cuts, coupled with a severe funding shortfall, have pushed the Afghan health system to the brink of collapse, with dire consequences for the population. And according to the MSF, the situation is dire and urgent intervention is needed. And so joining us now from Afghanistan is Claire Hardog, who is with the Doctors Without Borders in Afghanistan there. Claire, many thanks for joining us. We appreciate you for coming on. I mean, I have to start with the most important question here. How has the reduction or withdrawal of USAID affected the overall functioning of the health sector in the entirety of Afghanistan?
Well, the effect is quite dire. There's many facilities that have closed, and well, following the withdrawal of the coalition led by the US already in 2021, the economic system in Afghanistan collapsed, and what has remained has been withdrawn this year. So the entire health system, which was based on the BPHS system, so based on donors funding the primary health care, is really looking for fundings and is working quite difficultly with shortage in health staff and shortage of drugs. And we can see that the people of Afghanistan have more and more difficulties to get access to health care because it needs a qualified personnel and it needs drugs. And we can see that they are arriving in our hospital after exhausting a lot of possibilities, and they come to the hospital in the capital of the province where we work. We work in 9 hospitals in capital of provinces, and they have to go from the primary health center to a district hospital, and where the level of care is not enough because there's not enough people, because there's not enough funding, and they arrive quite late to our hospital in a very dire situation.
Dire indeed. I can only imagine the women and children. I mean, in what ways are children and women most acutely impacted by the aid cuts? Are there specific health services that have been disrupted?
It's a whole economy, but the health services are mostly affected because it is public services, and it was set up as a public services financed by the donor, and the women and children are, basic primary health care. If a child, when he's sick, it can be quite quickly be very deadly for the child. And we can see a situation where they need with acute malnutrition of the child, with people coming from 1 hour or to 1 day of travel away from our hospital. But also the problem is that the social pressure on women in Afghanistan makes the access for women to healthcare quite difficult, because a woman has to have a companion or guardian, let's say, to accompany her to the hospital, who is not always available. So it doubled the cost for access to care, and restriction on jumping in a cab or in a bus if you are a woman alone with a child, make it impossible for some of the children or women to access the health facilities. adding to that, the pressure on a health practitioner to have only female health practitioner being able to treat female makes it quite difficult.
So shortage in personnel, shortage in tools and medicine, and just shortage all around. Just for the sake of our viewers, what is the most common health condition or challenges that the children in Afghanistan face currently? And what are you doing, Doctors Without Borders, as a MSF, in sort of to mitigate the challenges, to sort of aid these children?
Well, they have, let's say, common disease, which will be, upper infection, or what is quite specific lately this year is some epidemics who can be avoided by vaccination campaigns, such as measles. There was a very big measles epidemic this year and 2 years ago. So there is not enough vaccination campaign, and the coverage is not enough. We also see lately more and more malnutrition cases, which are a bit worrying, and a bit more specific to this situation.
All right. Well, Claire, I must say thank you for taking out the time to join us. Claire, there, she's with Doctors Without Borders in Afghanistan, just raising concern following the cuts of USAID and just the dire health situation when it comes to public health care in Afghanistan. Claire, once again, thank you.